We are going to do a lesson on communicating with an older adult living with dementia. In this lesson, you will learn to define mild dementia and identify positive communication strategies for older adults living with dementia. We're going to work through this training together. So I will be clicking through the videos. Might look a little wonky at times, but it's the perfect way for us to do this together. So first, let's watch this video learning about the signs of mild dementia and strategies for communicating with older adults with mild dementia.
Dementia is a progressive, irreversible decline in mental and social functions. Although there are many types of dementia, Alzheimer's is the most common. As any dementia progresses, your client may experience loss of memory, judgment, learning ability, and orientation, and as this happens, communication becomes more difficult. There are a variety of skills you can learn to help you communicate with your client, depending on the type and severity of their dementia. Early stage dementia is usually marked by mild or moderate memory loss, specifically around the ability to recall recent events. Your client may quickly forget new information, misplace items, need more notes to remember tasks, or have other sudden changes in behavior. Safety first. Is there an immediate safety risk for the person with dementia to perform this task alone? If there is no immediate risk of injury or harm, provide encouragement and continue to provide supervision as necessary.
What do you need, Joan? Joan, do you need something?
What? Oh, what was I looking for?
I don't know. Did you want something to eat or drink?
Yes.
Okay. I just got some apple juice.
Have you seen my glasses? I want to read.
They're around your neck. Here they are.
Oh, silly me. I'd lose my head if it wasn't attached.
That's okay. Did you want something to drink?
I don't know. Do we have any apple juice?
We do. Would you like me to pour you a glass?
Okay.
Okay.
Older adults living with early stage dementia may easily forget recently learned information, repeat themselves, or ask the same questions repeatedly. They may also have poor hearing or eyesight unrelated to their dementia, making it harder to communicate because they miss not only conversation, but nonverbal cues.
Would you like to sit with me?
Okay.
There you go.
Clients living with dementia can experience pain, illness, or medication side effects, just like clients without dementia, that make good communication even more difficult. If you observe your client experiencing a change in sleepiness, increased confusion, dizziness, upset stomach, or a change in bowel habits like diarrhea or constipation, talk to your supervisor and decision-making family member about what you notice.
Stupid things.
Here, let me.
Oh, okay.
You know, we really should get you some Velcro shoes or slip-ons.
I'm sorry.
It's okay, don't apologize. It's just we have an appointment in half an hour and we don't want to be late. You got your glasses, make sure you have your hearing aid, and oh, don't forget your sweater. It gets so cold in that office.
Have you seen my glasses?
They're around your neck, like they always are.
Oh, yes.
Are you ready?
Okay.
Okay, let's go.
A person with early stage dementia may need prompting to maintain activities of daily living, or ADLs, like eating, bathing, and dressing. You may also need to help with instrumental activities of daily living, called IADLs, like preparing meals, managing money, and housework. There are specific tactics that can help you communicate with your client more effectively. Before helping your client with a task or giving guidance, take the time to determine their specific needs. Don't assume they need help with everything. It's very important to help your client maintain independence whenever possible. So start by asking them what they would like help doing.
Stupid things.
It's okay.
I'm sorry you have to wait.
I'm in no hurry at all. You take your time.
Rushing can increase confusion, so give your client plenty of time to accomplish tasks at their own pace.
Finally.
There.
Why is it so hard?
But you did it, right? See, never give up. Now, you have your glasses,
Yes.
and your hearing aid.
Yes.
Ready to go?
Break tasks down into simple steps and try not to give too many directions at once. And use positive statements instead of negative. For instance, instead of "don't forget your sweater," say "bring your sweater." Memory loss can lead to feeling overwhelmed quickly, which can complicate communication. It'll help to communicate with your client in a low-stress environment. That means turning down the TV, making sure there's adequate lighting, and if there are others involved, speak one at a time instead of all at once. Ignoring your client can lead to feelings of isolation and depression, so be sure to specifically include your client in conversations and speak directly to them.
Well, that went well. Good job on your hearing test.
Thank you.
Now, do you need to go to the bathroom?
Not now.
You sure?
Of course I'm sure.
Okay. You let me know when you do.
It's warm in here.
Let's get your sweater off. Now, you should take a seat and rest. Would you like something to drink?
Do we have any apple juice?
We do. I'll get you a glass.
Have you seen my... What are they? You know, my...
Oh, what do you use them for?
for seeing. So I can see.
Mm-hmm.
Glasses. That's it. Have you seen my glasses?
Check around your neck.
What?
They're right here.
Oh, good heavens. If they were a snake, thank you. Do we have any apple juice?
Yes, I'll get you a glass. There you go.
What is this?
Your apple juice.
No, thank you.
I'd like you to have some. We've had a busy afternoon and you need it.
I'm not thirsty.
Just a sip, please.
Oh, all right. Satisfied?
Yes, thank you. I'll put the rest right here if you want some more.
Is the air conditioner on? It's freezing in here.
Let's get your sweater. There you go. How's that?
That's fine.
Do you need anything else?
What?
Do you need anything else?
I didn't see him, no.
Is your hearing aid on?
What's that?
Your hearing aid. Is it on?
Oh, no. No wonder.
There you go.
Hearing aids can be very expensive to purchase and replace, so help your client keep track of them and use them daily. If they don't wear hearing aids, but you feel they're having trouble hearing, talk to a family member and your supervisor about scheduling a hearing test. Poor eyesight often leads to a feeling of disorientation and agitation. If your client wears eyeglasses, make sure they're within reach and the prescription is up to date. It's important to remind your client to keep track of their glasses and wear them whenever needed. If you feel your client is having trouble seeing, talk to a family member about scheduling an appointment. And of course, if you think that your client is in pain, tell the decision-making family member and your supervisor.
So let's talk a little bit about signs of mild dementia. Mild dementia is usually marked by mild or moderate memory loss, specifically around the ability to recall recent events. Some signs of mild dementia include forgetting information learned recently, asking the same questions repeatedly, more dependence on notes to jog memory, calling things by the wrong name, forgetting directions to familiar destinations, forgetting people's names, difficulty managing finances, misplacing things, near accidents or accidents with cooking, and sudden changes in behavior. Now let's take a look at characteristics of mild dementia. Some of the characteristics of mild dementia may impact communication with older adults at this stage. Repetition is one. Older adults living with dementia may repeat themselves or ask the same question over and over. Frustration. Older adults living with dementia may feel overwhelmed easily or get frustrated around communication difficulties such as word finding. Hearing difficulties. Older adults living with dementia may have poor hearing or wear worn or old hearing aids. These limit effective communication. Limited eyesight. Older adults living with dementia may have poor eyesight that limits communication, making the older adult unable to read lips or understand body language. Pain and illness may negatively impact communication for older adults living with dementia. And medications. Side effects of medications may affect communication. You should monitor for any possible side effects of your client's medications such as sleepiness, confusion, dizziness, diarrhea, or constipation, or upset stomach, and talk to your supervisor about what you notice. Now let's take a look at tactics for communicating with clients that are living with mild dementia. As dementia progresses over time, communication becomes more difficult. So we're going to click through these regarding assisting and giving directions. Prompting. A person living with mild dementia may need prompting to maintain their activities of daily living like eating, bathing, and dressing, and the instrumental activities of daily living like preparing meals, managing money, and housework. Determining needs. We need to take the time to determine the older adult's specific needs. You can start with asking the older adult what they would like help doing. Do not assume they need help with everything. It is very important to support the older adult living with dementia and preserving independence wherever possible. For example, let the person tie their own shoes until they are no longer able to do this, even if it takes a bit longer than you doing it for them. We also can break down tasks into simple steps and try not to give too many directions at once. We should also use positive statements instead of negative. For example, instead of "don't drink soda," say "here's a glass of water." And we should avoid rushing. Avoid rushing and allow adequate time for older adult, as rushing will increase their confusion. Regarding communicating, we need to speak directly, include the older adult in conversations, and speak directly to them. Do not ignore the older adult, as this can lead to feelings of isolation and depression. Also, communicate in a low-stress environment. Communicate with the older adult in a low-stress environment with no loud TV, adequate lighting, one voice at a time, remembering that memory loss can lead to feeling overwhelmed quickly, which will inhibit communication. We also need to be patient and prompt the older adult to try to describe what they are saying in a different way so you can understand. Do not interrupt or finish the older adult's sentences unless they ask for help. Also, you can try reflective listening, for example, saying, "This is what I heard you say. Is this correct?" We also need to look at their physical needs, encourage proper nutrition and hydration, as thirst and hunger cues diminish with age and memory loss. We should be very aware of the temperature and determine if the older adult is cold or hot. Use air conditioners, fans, and sweaters as seasonably appropriate. Help them keep track of their hearing aids. If the older adult has hearing aids, make sure they are working properly and are worn daily. Talk to your supervisor about scheduling a hearing test if the older adult is having trouble hearing. Remember that hearing aids can be very expensive, so it is very important to help an older adult living with dementia keep track of their hearing aids and help them remember to wear them daily. It can cost a lot of money to replace lost hearing aids. Keep track of eyeglasses. Poor eyesight often leads to feeling of disorientation and agitation in older adults living with dementia. If the older adult wears eyeglasses, make sure they are within reach and have an up-to-date prescription. Talk to your supervisor about scheduling an eye appointment if the older adult is having trouble seeing. It is an important caregiver job to remind the person to wear their glasses and to help the person keep track of their eyeglasses so they don't get lost. Also, always share any concerns about pain that you might have with your client. Next, we'll talk about introducing positive communication strategies for older adults living with dementia.
Still working on that book?
What? Oh, you startled me. Yes, it's wonderful. He reminds me of my father. He was the salesman.
I didn't know that. That's interesting. You want to get ready for bed?
Okay.
Okay, so brush your teeth and try using the toilet, and then we'll get your slippers off and get you in the bed, okay? No. Teeth first, then slippers. Okay?
Oh, okay.
Okay. Don't forget to floss.
Middle stage dementia is a more severe memory loss where some distant memory is retained, but new material is quickly forgotten. This stage is typically the longest and can last for several years. In middle stage dementia, damage to the brain can make it difficult to express thoughts and perform routine tasks. You may notice the person jumbling words, having trouble dressing, or refusing to bathe. There may be personality changes like getting frustrated or angry or acting unexpectedly. Being a caregiver for someone in the middle stages of dementia demands flexibility and patience. As their ability changes and functioning independently becomes more difficult, you'll have to take on greater responsibility. Daily routines will need to be adapted and structure will become more important. Here are a few additional tips. Prepare yourself for the challenges of middle stage dementia by familiarizing yourself with its symptoms. When your client asks the same questions repeatedly, respond with patience and a calm voice. Your client may really be looking for reassurance, not answers. So don't necessarily respond to the question itself so much as the emotion behind the question. If your client can still read, help them by providing written reminders so they can handle some tasks on their own. Tell your supervisor if you're seeing changes in behavior or ability. A doctor's visit might be needed to rule out illness or side effects from medication.
Hi, just checking in. Do you need to use the restroom?
No,
Are you sure? It's been a while.
I'm not a child. Of course I'm sure.
I understand, but I have to check. It's time to wash up for dinner now anyway, so let's take care of that, okay?
Oh, okay.
Maybe we'll change your pants too, just to freshen up a little.
I didn't. Oh,
It's okay.
darn it. You must feel like you're babysitting a child.
No, it's not a problem. Really, we'll take care of it. It's no problem. Let's go. Okay, let's see. Okay. There you go. How's the book?
What?
The book. Is it good?
Oh, yes. He's running from the man with no nose.
Voldemort?
Is he the one with no nose?
Mm-hmm.
Silly. I don't know why they couldn't give him a nose. Can you imagine? No ears either. I don't understand how he got those glasses to stay on. The kids he went to school with must have been terrible about that. No nose, no ears, a scar on his forehead. Children can be so cruel. My mother, she was a school teacher, you know. She wouldn't tolerate any of that nonsense in her classroom. And we couldn't get away with it either at home, I'll tell you. Any sass or any back talk, and we'd get into trouble. When Father got home, he was a door-to-door salesman, you know.
Oh.
He sold those, what are they? Those things. Oh, you know, those things. They're square. You know what I mean. They're square. Oh.
That's okay. I bet your father was a really good salesman.
He was wonderful. I loved him so.
Oh, I bet you miss your father and mother from time to time. They sound lovely.
Have you seen my glasses?
Maintain eye contact when communicating and try to approach the older adult from eye level or lower. Standing above your client can make them feel threatened.
Hi, Joan. It's time for bed now.
Reduce distractions. Use a calm voice and speak clearly, slowly, and in a friendly tone.
What, now? That's ridiculous. I just had breakfast. It's barely 10 a.m.
I liked your hearing doctor. She seemed nice.
When did you meet my doctor?
This afternoon at your appointment. Remember?
Oh, that's right. She's really nice.
I thought so. So are you excited about your new hearing aid?
It's great. I hear everything now.
Good. So let's go brush your teeth.
Okay.
Don't argue with your client. If they're saying something that you know is incorrect, try to move the conversation around the issue rather than directly contradicting them.
Okay. Sit on the bed, please. Good. All right, now take your slippers off. Okay. Now we're gonna lie down.
Give simple directions, one step at a time.
All right. Would you like to read a while?
Yes, I would.
Okay. There you go. All right, now be back in 20 minutes, okay?
All right.
Okay.
Ask yes or no questions whenever possible.
All right, let's try to use the bathroom once more before bed. All right, stand, please.
Where are we going?
We're going to the bathroom.
Oh, all right.
Okay.
Your client will need more assistance with ADLs and IADLs, like choosing proper clothing for the season and remembering to use the toilet. Your client will also need assistance with regular bathing. Communication difficulties can cause your client to withdraw, leading to feelings of depression.
Hey, we were just talking about your garden. What do you think? Should we have someone plant some roses?
I like roses.
I know you do. I think you'd enjoy having them.
Actively engage your client in one-on-one conversations to avoid feelings of exclusion and isolation. Try to be flexible, patient, and supportive as your client tries to communicate. The way you say something is often more important than what you say.
What do you need?
Have you seen my glasses? Oh, why can't I remember that?
That's okay. That's why I'm here. So, what do you think about white roses?
If your client repeatedly asks a question, remember that they can't recall the answer you just provided. Instead of answering the same question multiple times, try reassuring them that everything is fine and you're there to help. Then try to distract them by discussing a new, pleasant topic.
Would you like some help eating? Let me help you.
Be observant. You will need to adjust your communication tactics as your client's needs increase and change throughout the stage.
Next up, let's talk about barriers to communication. Older adults living with moderate dementia have more severe memory loss, where some distant memory is retained but new material is quickly forgotten. This period is typically the longest and can last for several years. Barriers to communication for those with moderate dementia include difficulty finding words, repeating questions, losing their train of thought, reverting to native languages or nonverbal communication styles, and being frustrated and embarrassed by progressive loss of function, including incontinence. We'll spend a moment now taking a look at some communication do's. So, speak calmly. Use a calm voice and speak slowly, clearly, and in a friendly tone. Give clear, simple instructions. Be flexible and patient and observant, as the client's needs will increase as dementia progresses. Maintain eye contact when communicating and try to approach the client from eye level or lower. Standing above them may feel intimidating to them. Ask yes or no questions, one question at a time. For example, instead of saying, "What do you want for breakfast?" say, "Do you want eggs for breakfast?" Assist with ADLs and IADLs. With dementia, an older adult will need more assistance, such as choosing the proper clothing for the season, reminders to go to the bathroom, and assistance with regular bathing. We should also use visual cues and written notes to communicate. For example, pick up the toothbrush and show the action of brushing your teeth rather than saying brush your teeth. Also, redirection. If the older adult living with dementia repeatedly asks a question, remember that they cannot recall the answer you just provided. Instead of answering the same question multiple times, try reassuring the person that everything is fine and you are there to help them. Then try to redirect them by discussing a new, more pleasant topic. Also, use humor. Try to laugh together about misunderstandings and mistakes. Also, show compassion and empathy. Try to be patient and supportive as the older adult tries to communicate. The way you say something is often much more important than what you say. Here are some communication don'ts. Exclusion and isolation. To avoid feelings of exclusion and isolation, be sure to actively engage the older adult in one-on-one communication. Decreased socialization is common due to communication difficulties and can lead to feelings of depression. Multiple stimuli. Try to ensure a calm setting without multiple stimuli, like no loud TV or radio or multiple voices. It can really be overwhelming to someone living with dementia. Arguments. Do not, under any circumstances, argue with an older adult. If the older adult is saying something that you know is incorrect, try to move the conversation around the issue rather than directly telling the person they're wrong or contradicting them. Next up, we have strategies for communicating with an older adult living with severe dementia. We're going to watch this video that's about communicating with an older adult with severe dementia.
Hello? Hey. No, I'm at work. Nothing. She's in bed. Nope, just hanging. Reading a gardening magazine because I forgot my Kindle. Oh my god, holy cow, I know all about geraniums now. Yeah. I don't know, maybe later. I don't really have to do much cooking anymore, so. Yeah, okay. Well, I'll just call you later then. Perfect. Sounds good. All right, bye-bye.
Late-stage dementia is severe memory loss where only fragments of memory remain. A client in late-stage dementia may lose the ability to speak, walk, and eat. This stage usually lasts a couple of years and will end in the older adult's eventual death. The needs of a client living with late-stage dementia will change and become more intense and demanding. They may have trouble eating and swallowing. They might need help walking or become incapable of walking altogether. Your client may need assistance with personal grooming, toileting, and other personal care. And they'll be more prone to infection, particularly pneumonia. When your client has late-stage dementia, your goal is to maintain dignity and quality of life. Research has shown that although your client will lose the ability to communicate, some essence of the person is still there and you can connect with them. But without speech, they'll be more dependent on the other senses to interact with you and the world. So you can provide care through touch, sound, sight, taste, and smell. You can cook their favorite meals, play the music they love, read from books or magazines they enjoy, or look through family photo albums with them. Spend quiet time applying lotion or brushing their hair, or just sit outside in the fresh air. Older adults with dementia become nonverbal as the loss of brain cells impacts the speaking part of the brain. Repetitive behaviors increase, and depression and anxiety are more common.
Hey, Joan. It's Liz.
Always approach the older adult from the front and identify yourself. Irritability can increase. Don't take this personally as it reflects the disease, not the person. Sleep changes are common, like sleeping during the day and being awake at night. Clients in late-stage dementia need full assistance with all ADLs and IADLs. Try to understand the emotion behind words or sounds as clues to what the older adult may be trying to communicate. Again, how you say something is more important than what you say. Keep talking. Even if your client isn't able to speak anymore, talk to them about family, friends, and topics or activities they used to enjoy.
We'll spend a couple minutes talking about barriers to communication. In severe dementia, there is acute memory loss where only fragments of memory remain. The older adult living with severe dementia may lose the ability to speak, walk, and eat. This period in the progression of dementia usually lasts a couple of years and will eventually end in the older adult's death. Barriers to communication in severe dementia include being nonverbal, as brain cell loss impacts the speaking part of the brain. Irritability. Do not take this personally, as it most often reflects the disease, not the person. An increase in repetitive behaviors, depression and/or anxiety, and sleep changes, such as sleeping during the day or being awake all night. Let's talk a little bit about communication dues. Using the other senses. Someone with severe dementia will use other senses to communicate, such as the sounds, smells, taste, touch, and sights. With older adults living with severe dementia, for example, you should listen to music, read books, look at photos, cook, rub lotion on their skin, brush their hair, sit outside. Touch should always be professional and appropriate. Remember to respect your client's personal preferences and cultural ethnic norms. Older adults living with severe dementia need full assistance with all ADLs and IADLs. Those are activities of daily living. We also have to understand the emotion. So when communicating with an older adult living with severe dementia, you should seek to understand and support the emotion behind words or sounds as clues to what the older adult may be trying to communicate. How you say something is more important than what you say. We should also keep talking, even if the older adult is no longer able to speak anymore. Talk about things that they used to enjoy and family and friends. We should avoid terms like diapers. Those are infant terms that sound cute, like diapers. Prioritize dignity and respect when communicating with clients. Always approach the older adult from the front and identify yourself. Next up, we're going to move on to the fourth lesson in this set, which is overcoming communication challenges due to dementia-related behaviors. This lesson covers communicating with older adults living with dementia who have changes in their behavior. We're going to take a few minutes to watch another video.
Joan, what are you doing? You need to get back in bed. Come on, stop it, okay? You should have been in bed an hour ago. Come on. Look, I don't have time for this, okay? Just do it so we can both get some rest. All right, you know what? You'll feel better. We'll wash your face and then... You don't hit me. You understand me, Joan? Not ever.
Your client may present aggressive or hurtful behaviors. It's up to you to find the correct, measured, appropriate response that serves your client's best interests while protecting yourself from undue stress or harm so you can continue to care for your client. Do your best to identify what triggers these sorts of behaviors in your client and then try to avoid them. Consider underlying factors like hunger or thirst, pain and illness, feeling too cold or too hot, being overwhelmed, feeling sad or depressed, or boredom. Use distraction as a tool to guide the conversation to pleasant topics. Listen, speak calmly, and then try to change the subject. Changing the subject helps refocus your client on something positive, and because of short-term memory loss, they may quickly forget the sadness or anger they were just experiencing. If they continue to be uncooperative, don't argue or contradict them. Stop and try again later. Count to 10 before you respond. If you need to, leave the room to separate yourself from aggressive or hurtful behavior while you calm down. If your client is showing sad or depressed behaviors, like being excessively tearful, not eating normally, or refusing to leave the bedroom, get dressed, or bathe, let the older adult express their feelings without trying to cheer them up immediately. Sometimes just being there to listen is the best way to show you care. Physical contact, like holding or patting the person's hand, can be reassuring. Be sure to ask for permission first. Offering comfort through validation can help your client feel understood.
So let's talk for a moment about coping with aggressive behaviors. If the older adult is showing aggressive behavior, try to identify and then try to avoid whatever the triggers are. Count to 10 before you respond. Leave the room if you need to cool down or the person is saying harmful things to you. Stay calm and don't argue with or contradict the older adult. Listen, speak calmly, and then try to change the subject. Stop and try again later if the older adult is uncooperative. Consider factors that may be leading to agitation such as hunger or thirst, pain and illness, feeling too hot or too cold if they're feeling overwhelmed, maybe sad or depressed, or even bored. Use redirection as a tool to guide the conversation to pleasant topics if the older adult is getting agitated. Changing the subject will help the person focus on something positive, and because of short-term memory loss, the older adult may quickly forget the sadness or anger they were just experiencing. Let's take a look at what to do for sad or depressed behavior. Older adults living with dementia may show sad or depressed behavior. Examples of sad or depressed behavior include being excessively tearful, not eating normally, not coming out of their bedroom, or refusing to dress or bathe. So first, what we can do is listen. Let the older adult express their feelings without us trying to cheer them up immediately. Sometimes being there just to listen is the best way you can help. Offer physical contact. Sometimes physical contact, such as holding or patting the person's hand, can be reassuring for the older adult, but you should ask for permission first. Note, touch should always be professional and appropriate, and remember to respect your client's personal preferences and cultural and ethnic norms. Also, you can offer comfort through validation. An example might be, "I know you miss your mother and she loves you too. This can help the older adult feel understood. Another important topic is how to cope with the emotional responses to dementia. When you're working with older adults living with dementia, you may find yourself having to help your clients' loved ones deal with feelings of grief and loss. You may also find yourself experiencing similar feelings. It's important to recognize that these feelings are normal. The changes caused by Alzheimer's disease and dementia result in the loss of that person that loved ones have known, so it's important to grieve the loss. The grieving process is different for every individual. It could look like denial. Denial is a way people deal with situations and information that is hard to accept. Be honest and supportive and say, "I'm sorry to hear your situation. It must be very hard." Grief. Family members may feel sad about losing a future with the client. You may grieve your client's losses. Grief may cause people to cry often, withdraw from social activities, or withhold emotional responses. So support family members listening and acknowledging their feelings. Recommend participating in enjoyable activities and companionship. Talk with your supervisor and coworkers about your feelings, and find a professional therapist or join a support group. Guilt. Family members feel guilt for their past relationship with the client or for negative feelings about the client now. They may try to make up for guilty feelings by visiting more often or trying to do more for the client. Remind family members that the situation is no one's fault. Anger. Family members may feel the client's situation is not fair to the client or themselves. They may become resentful of the client or the caregiver and may direct anger towards others and blame them. Don't take this personally. Notify your supervisor and seek advice if you are unsure how to respond and manage anger from family members. And tell your supervisor if you feel angry and ask for advice. Acceptance. Acceptance comes from recognizing the reality of what is happening. When loved ones accept the situation, they are able to find more comfort in the time they still have with the client. Now that we have completed all of the modules, including communication with someone with mild, moderate, and severe dementia, as well as overcoming communication challenges, we'll take a 16-question final exam in order to show that we have passed and can be certified on communicating with a person with dementia. Thank you for your attention to this module.